So let us discuss about thyroid drugs as a topic of today. So we will discuss about thyroid drugs. These are drugs which act as thyroid hormones. You remember that we talked about thyroid gland produces three types of hormone. One hormone is T3, T4, and calcitonin. So, if the thyroid is not functioning well, it is unable to produce these hormones. So, let us see the type of drugs which are manufactured for the purpose of replacing these hormones in the management of hypothyroidism. The patient who have you have to give a supplementation of those hormones in case they don't produce those hormones. So that is our today's topic. So our today's topic is about thyroid, thyroid drugs. And our two major drugs we are going to discuss about is levothyroxine, levothyroxine, which is as levo, which is T4, T4. This drug, it can be either oral drug or also can be as an intravascular drug. The other drug, which is levothyroxine, is called Leo thyroxine, leothyroxine, which is T3, and this drug is specifically used as intravascular. It is specifically used as intravascular, and specifically it is used in treatment of myxoedema. Myxoedema. Myxoedema is the only places where you use this drug. So let us look at pharmacokinetics of these drugs. The two drugs is what? Is leothyroxine and levothyroxine, which are the two major drugs which works as what? Thyroxine drugs. So let us look them at pharmacokinetics of these drugs. Pharmacokinetics of these drugs. So, levothyroxine is bioavailability is 75%. Is 75% bio. That is T4. That is levothyroxine is bioavailability is 75%. If is taken orally. If you take this drug orally, it is what? Uh, it is 75 bioavailability. And these drugs should be taken on an empty stomach. Should be taken on a empty stomach. That means because the drugs, this one interferes with the absorption of these drugs. Now, in you are taking when you are prescribing these drugs, you have to be very careful because of drug interactions. Let us look at drug interactions of these drugs. Now, there is two types of drug interactions of this type of drug. One drug interactions is the drugs which interferes with absorption of this drug, and the other one is the drugs which accelerates the metabolism of these drugs. So let us first of all look at the drugs which interferes with absorption of this drug. The drugs which interferes, which reduces absorption of these drugs are what? An example of one of these drugs which interferes of this drug is like iron, calcium, surfactant, which is used in the treatment of gastric ulcers and also a proton pump inhibitors. These drugs, you have to be very careful when you are giving with the levothyroxine because they reduce absorption of the drug. That is iron, calcium, surfactant, and proton pump inhibitors. Now, when you find yourself in a such a situation where you have to give these two types of drug at the same time, you have to ensure that either there is a wide difference of time when you're giving the drug or you can avoid the drug. So the other type of drug interaction of these drugs is the drugs which accelerates metabolism of levothyroxine. The drugs which accelerate metabolism of these drugs increases metabolism of these drugs is, for example, the anti-TB drugs called ribavirin, and also a psychotic drug like phenytoin, and also carbamazepine and carbamazepine. So, uh, carba, carbamazepine, ribavirin, and phenytoin drugs. These drugs makes the drugs increased in terms of metabolism of the levothyroxine. So that is how these drugs work. So as we continue with our discussion, let us continue with the discussion of these drugs. Now, let us discuss about what about metabolism of these drugs. So metabolism of these drugs, we have to discuss this like that of these drugs. And let us see the metabolism of these drugs. We discuss the metabolism of these drugs. And the metabolism of these drugs is very, 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 very what? Very interesting. The metabolism of this drug is very so we have talked about T3, which we have called it Leo, thyroxine, deoxyzine. Onset is fast, and the action of duration is short. Uh, action of effect is short, so does not stay longer in the body. Okay, and this drug is preserved. This drug is preserved. This drug is preserved for conditions like maxoedema. Maxoedema. You know, maxoedema comes like when you give drugs like AC inhibitors. AC inhibitors. So advanced drug reaction, advanced drug reactions is the signs and symptoms of hyperthyroidism in overdose. Okay, in overdose is very common. It's very common, and also it has a risk of cardiac arrhythmias. It can also cause cardiac arrhythmias, and also it can cause angina pectoris. It can also cause angina pectoris. Also, it can cause a cardiac failure. It can cause a cardiac failure, and also it can cause osteoporosis. It can cause osteoporosis. Also, osteoporosis. In hypersensitivity cases of this drug, it can cause pruritus, it can cause itchiness, and also it can cause pruritus. It can also cause edema. So, in basic, the metabolism of T3 or lindioxine is the onset is very fast. It works very fast. It has a short action period. It is preserved for maxoedema and adverse effects, signs and symptoms of hypersensitivity in overdose, and also can lead to cardiac arrhythmias, can lead to things like angina pectoris, and also can lead to cardiac failure, and also osteomyelitis, can lead to osteomyelitis. So, the mechanism of action of this drug is what? The mechanism of action of this drug is what? Now, the mechanism of this drug is a very, very simple mechanism of action. Mode of action is what of this drug? The mechanism of action of this drug is very, very simple. So you know very well that T3, T3 on the nucleus of the thyroid receptors, that is where it is bound. It binds to the nuclear receptors. It binds to nuclear receptors of thyroid cells, of thyroid cells. that is where it bounds. So it affects the what? The cell is bound, that drug, that is where it is bound. That is where it is bound. Okay? Now, let us see the treatment or the uses of this drug. This drug called thyroid drug, they are used for what purpose? They are used for what purpose? Now, these drugs are used in so many cases, like in replacement therapy. We use them as a replacement therapy in children. In children, when you are treating something called cretinism. Cretinism is when you are used in children. And number two, also they are used uh, in treatment of hypothyroidism. Hypothyroidism, hypothyroidism in adult, also used in hypothyroidism in adult. They are also used in treatment of myxo edema, used in treatment of myxo edema, edema, and also they are used in treatment of non-toxic goiter. They are used in treatment of non-toxic goiter. Also, they are used in thyroid nodules. Thyroid nodules, nodular diseases, okay, of certain cases. Also, they are used in papillary carcinoma of the thyroid. They are also used in the papillary carcinoma of thyroid, papillary carcinoma of the thyroid, and also they are used in empirical treatment of refractory anemia. Empirical treatment of refractory anemia. Refractory of anemia, or sometimes in treatment of empirical treatment of infertility, and also depression, So that's the time we use these drugs of thyroid type of drug. We can call them thyroid supplement. So basically, we have seen that the thyroid gland, in summary, we have seen that the thyroid gland produces three types of hormone. That is T3, T4, and also calcitonin. Now, you have seen that T4, um, T4 is the one which circulates most of the time in the body, and we have seen that T3, it is short acting and a short duration of action. It is used in management of myxoedema intravasculars, whereas T4 is available either as oral or as IV drug. Also, we have seen that adverse effect, it can cause hypersensitivity. In overdose, it can cause arrhythmias, it can cause heart failure, osteomyelitis, and angina pectoris. In hypersensitivity can cause pruritus, itchiness, and edema. And also, we have seen that the mechanism of action, it binds to the nuclear of thyroid cells. It is used in treatment of cretinism in children, and also hypothyroidism in adults. It's used in myxoedema in nodular goiter. It is also used in papillary carcinoma of thyroid, and in treatment of empirically of refractory anemia, or in cases of depression or infertility. So basically, that is the end of today's topic in terms of thyroid gland. Thank you very much for listening to us.